Hello, Dr. Bob. I want to talk to you about rhythms and migraine. So there are different times that we get migraines, and there are different levels and types of cycles of migraine that we get. So for instance, people notice that they get migraines at different times of the month, and women may notice that with their cycles, but actually there's also a lunar effect. And so some things like babies tend to come more with a full moon. So babies in emergency room visits have about a 7% effect of increase. So there are 7% more babies delivered, and there are about 7% more emergency room visits and admissions to the hospital during the time of the full moon. So that's one cycle that's kind of a mid-range cycle. There are also things that happen on a daily cycle. And so one of the headaches that's the most associated with that is cluster headaches. Cluster headaches have a strong circadian rhythm. And so people with migraines may also get a tendency to have a circadian rhythm where their headaches happen more at different times of day. So they may wake up with them. They may have them at night. They may get them in the afternoon. And there are other factors, as we've discussed, that can be related to that. So things like your blood sugar getting too low, that can be a factor. But just the cycle of the daily rhythm can do that as well. So for instance, your cortisol is high in the morning. It spikes up. When you wake up, that there's a surge of cortisol, and it's highest around 8 in the morning, or whatever your equivalent of 8 in the morning is, and then it goes down in the evening. And cortisol and melatonin are opposite. And so when cortisol goes up, melatonin goes down. And when melatonin goes up, cortisol goes down. And so that's the 24-hour or circadian rhythm. So cluster headaches are often very clockwork-like, and they will probably happen very close to the same minute every day for some people. Migraines, on the other hand, just have a tendency to go more at one time or the other of the circadian rhythm. But there's another rhythm that we haven't talked about, and that's the ultradian rhythm. And ultradian rhythms are long cycle. So that monthly rhythm of the moon, or the monthly cycle rhythm that people have when they get headaches with their menstrual cycle, those are longer cycle rhythms. But a longer cycle rhythm still is a seasonal rhythm. And so there are some diseases that happen more at different seasons of the year. So for instance, peptic ulcer disease or stomach ulcers happens more in the spring and the fall. And cluster headaches, people will often, about 85% of people with cluster headaches will get headaches more in the spring and the fall. About 15% of people get them all year round. That's called chronic cluster. But episodic cluster headaches usually happens for several weeks in the spring and several weeks in the fall. Ulcer disease does the same, and we've noticed that some migraine patients tend to get more headaches in the spring and the fall. So there are certain things that come on in long cycle surges, and then long down cycle periods, and then long cycle up. And those are called ultradian or long cycle rhythms. And so that's something else that you should know about, is that you may say, well, I haven't had headaches for a long time. I really haven't changed anything. Well, sometimes things that can change are things in the environment. And one of those is the cycles of the seasons. So people, for instance, with migraine, especially migraine with aura, but any migraine, have more tendency to have anxiety and depression type issues. So one of the types of depression that people get is SAD, or seasonal affective disorder. And most of the time people get seasonal affective disorder, they get that in the winter. So when the days get shorter, then they have more sadness, they have less light, they get more depression type symptoms. Sometimes people get a reverse of that, and they get that sadness or depression in the day when the days are longer and there's more sun. So there are many different rhythms in play. So there's the daily rhythm, there's the monthly rhythm, then there's a long cycle rhythm of the year. So you may observe some things that are related to these biologic rhythms, these deep rhythms of the earth, and that we are tied to in our own biologic clocks. And so that's something that I wanted to mention to you and have you start to observe for yourself in terms of, what happens to me on a day-to-day basis? What time of day do I get my headaches? If I'm a woman, is it related to the time of my menstrual cycle? Or is there actually a lunar effect? Do I find that either my mood or my migraines or both tend to get more intense around the time of the full moon? And then look beyond that, you may have to look back at a journal, and that's one of the reasons we like people to keep track of their headaches with a headache tracking system, is to look at your journal and see if you've gone through periods of high and low migraines, if they have any correspondence to the spring and the fall when some of those other kinds of biologic symptom-related things or illness-related things tend to come on. So all of these things are part of our biology, and our biology is part of what governs our nervous system and the rhythms and the hormones and all of the different communication pieces of our body, as well as how things function. So I'm going to ask you to think about those things. I like to keep just track of my headaches in my regular journal. So I'll just make a note. If I had a headache, if I had to take any medicine for it, how long it lasted, I'll just scribble that in my journal. Then when I want to do a weekly count or a monthly count, I'll just say, oh, count it up. I had 6 headache days this month. And I took medicine for 2 of them. And so that any kind of simple system like that where you just scroll it down within a few minutes. And if I look back at my journals from years ago when I was having headaches, I could tell there were periods of highs and lows. And I'm going to actually dig those out and look back and see if they related to the seasons. Because I know one season that it related to a lot was the Christmas season, because I'd always get really busy, have a lot of social stuff, have a lot of presents to wrap, have a lot of people to keep track of, try to write Christmas letters to everybody. All those kinds of things were stress, and my patients would be more stressed and want to get in. Kids would come home from the college, and we try to work them in over Christmas. Our partners and us would always try to get some time off. So the holiday season was a social-related seasonal cycle, but the others are more biologic related seasonal cycles. And I'd like you to think about those and keep track of them and see if you notice any significant factors related to that for your migraines. So have a good day. Thanks for tuning in.